wide-ranging national broadcast to basically say that the pandemic is now a pandemic of the unvaccinated, urging 80 million Americans to go and get vaccinated. He says it's free, it's effective, it's safe to get it done. Now, there are a lot of new things also that Lester Holt was talking about there, about companies with over 100 employees also requiring them to make sure that all of their employees do get the vaccination, and if they don't, to make sure that they are tested at least once a week. We're going to hear a lot more about this throughout the next couple of weeks, I'm sure.
But right now we have a local expert who's going to help us break that down a little bit more. Joining us now to talk about what we heard from the president is Dr. John Sellick. He is an epidemiologist at Kaleida Health. Dr. Sellick, thank you for being here. And let me ask you first, why do you feel it was necessary for the president to devote this national address to encourage yet more vaccination? Already 200 million people approximately have received it. So why is that still not enough?
I think it's very important, Mary Alice, from the point of view that there's general frustration with we should be at a point where we're getting beyond this. We're never going to make this coronavirus go away. But this thing that we always talk about, community immunity or herd immunity, we have to get better than 60% of the population immunized. And I think there's general frustration that we have very safe, highly effective vaccines that are not being fully utilized. So I think the whole idea is you see the president trying to jumpstart this. You see many companies. I saw that Qantas Airlines just said that they're going to start requiring vaccines. So I think that there's this general trend that we have the ability to make this better, and now we have to do it.
So explain to us, doctor, if you will, how does it not benefit us, or actually how does it hurt us or become more vulnerable when we don't have that herd immunity? Why is it really in everyone's best interest to get the vaccine?
It really is. It's for yourself and it's for everyone around you. What we've seen, especially now with the Delta variant, is that it is able to replicate to very high numbers and infect a much larger number of people. The huge surge that they've been seeing in the southern part of the country now for weeks is largely driven by unvaccinated people. So as that cycle of infection goes on, there are people who will infect others who cannot be vaccinated, the very immunosuppressed. And the other problem is when you let these little RNA viruses replicate, they will mutate. So the more we let them replicate, the more they're going to mutate, the more we're going to increase our chances of seeing something that potentially would be even worse than Delta.
So, doctor, what you're talking about then is all of the variants that a lot of folks are concerned about now, like Delta, and the need to get a booster shot. Is that why we have so many people right now interested in booking that appointment and getting that done?
Yes, I think that's very true. That there's huge interest. We've seen this a lot from the medical staffs at the hospitals. Unfortunately, we had some announcements made that there would be booster shots by September 27th or whatever the date was. The problem is that the science hasn't completely caught up, and you don't want to get this booster shot too early. This has got to be done in the proper sequence so that you maximize the immunity. And so far, neither the FDA nor the CDC's Advisory Committee on Immunization Practices has passed judgment on this. And I don't see that the CDC group even has a new meeting posted yet. So I think we have to wait for the data to be fully analyzed. We're all planning to roll out booster shots as soon as there's approval from the FDA and from everyone else. So we'll have the infrastructure in place. But I think it's going to be a little bit later than September 27th. And one of the main reasons is we're seeing lots of data now showing that the 2 doses of vaccine or the 1 dose of J&J are still working very well to do what they were originally made to do, which is keep you out of the hospital and keep you out of the morgue. So that part is working very well right now. But I think there's big concern that as we get into the colder weather and people going indoors, kids back to school, that again, there may be more spread. So I think we'll be seeing something with boosters. It's probably not going to happen in the next 2 weeks.
All right. Well, we will stay close, Dr. Sellick, and make sure we get the latest from you so we can pass that information along. We've been speaking with Dr. John Sellick. He's an epidemiologist with Kaleida Health. Thank you so much for being here tonight.
Thank you for having me.